Did the bullet that grazed Donald Trump's ear at a July rally cause any permanent damage? We asked a Beverly Hills plastic surgeon to find out. Former President Trump is continuing to heal from an ear injury he sustained on July 13, 2024, as he was speaking at a Pennsylvania rally. An assassination attempt left Trump missing part of his upper right ear. Former White House physician Ronnie Jackson told the New York Times. Jackson noted that Trump's ear is expected to heal through the process of granulation, in which new connective tissue gets to work repairing the wound. Jackson, now a U.S. representative, stated on The Benny Show that no additional medical intervention would likely be needed, and that the wound's appearance is expected to reduce over time.
He'll be okay. He's not going to need it. It's going to granulate and heal in, and he's not going to need anything to be done with it. It's going to be fine.
Health Digest spoke with Dr. Patrick Davis, a facial plastic and reconstructive surgeon located in Beverly Hills, about whether such ear injuries are known to cause lasting damage. On July 20th, Trump posted a statement from Dr. Jackson on Truth Social, in which the doctor described the former president's injury in greater detail. After reviewing the statement, Dr. Davis said that the wound is not likely to lead to complications in the long run. He explained that because the ear contains a great deal of cartilage, it receives a strong amount of blood flow, which supplies the organ with plenty of nutrients to support healing. Dr. Davis told Health Digest, "The issue to watch out for with bleeding is less about a concern for significant life-threatening loss of blood, but rather for the blood to pool between his skin and his healthy cartilage, causing excessive pressure that can lead to necrosis or death of the cartilage itself."
They saw the blood and thought, actually most did, that I was dead.
Cleveland Clinic experts explain that this is known as a subperitoneal hematoma, in which blood flow is reduced to the cartilage. Without proper drainage of the pooled blood to alleviate the pressure, this can leave the ear with a lumpy appearance, sometimes referred to as cauliflower ear. Trump has continued to keep his ear wound covered since the assassination attempt, which Dr. Davis feels is the right move to protect it from the elements. He told Health Digest, "Although some have mentioned that a bandage may be overkill for this injury, I tend to disagree, as ointment is important to keep on the wound with a bandage covering, which provides a proper healing bed for new skin to cover over his cartilage." Dr. Davis added that reconstructive surgery on Trump's ear probably won't be required unless the skin is unable to grow over the exposed cartilage. In his statement on Truth Social, Dr. Jackson said that Trump will undergo a comprehensive hearing exam. When asked if this is due to a risk of permanent hearing damage, Dr. Davis said that any long-term hearing issues are unlikely because of where the damage took place. He explained that the funnel through which sound makes its way into the eardrum was not injured, and therefore hearing should not be compromised in the long run. Dr. Davis added, "The bullet whizzing by his ear potentially could have caused more damage to hearing than the wound itself." But Dr. Davis said no negative effects on Trump's hearing are anticipated in this case. The question of whether or not Trump was at risk for a concussion following his ear injury has also recently been raised. Dr. Jackson has addressed these concerns, stating that the bullet did not strike close enough to the former president's head to cause a concussion.
It was far enough away from his head that there was no concussive effect from the bullet.
According to the Cleveland Clinic, although concussions do inflict damage on surrounding nerves, blood vessels, and alter chemicals within the brain, most mild brain injuries due to trauma do not cause lasting adverse effects.